There are a ton of myths surrounding sexual health, especially within the LGBTQ community, since a lot of us don't have access to sex education that is inclusive of our relationships and bodies. I'm going to dispel a few of these myths, but first, I want to clarify the language I'll use in this video. To refer to anatomy, I will use gender-neutral clinical terms, such as vulva, testes, and uterus. I will also use the terms AFAB, assigned female at birth, and AMAB, assigned male at birth. Myth 1. Penetrative partners can't get STIs. While the penetrative partner, or top, may be at lower risk for contracting STIs during sex, they are still able to contract STIs nonetheless. Using condoms and lubes during penetrative sex, vaginally or anally, protects both partners from STIs. Additionally, pre-exposure prophylaxis, PrEP, can be taken to prevent HIV infection. Penetrative partners should, like all sexually active individuals, make sure to get STI testing regularly. To learn more about STI testing at the health center, visit the Campus Health website at campushealth.tulane.edu or check out our video on STI testing. Myth 2. Sex that doesn't involve a penis doesn't risk STI spread. STIs can spread through genital fluids, including semen, vaginal fluid, and precum, blood, saliva, and skin-to-skin contact. This means that any type of partnered sex, including oral sex, digital or hand sex, sex using toys, and genital-on-genital rubbing, holds risk of spreading STIs. However, risk of STI spread varies among different sexual acts, and it's up to you and your partners to determine what risk you're comfortable with and how you want to minimize risk. Here are a few ways to lower STI risk when sex doesn't involve a penis. You can use a dental dam, which is a thin latex sheet, to prevent STI spread when performing oral sex on a vulva or anus. Keeping sex toys clean between partners by washing toys or using condoms on toys can reduce risk of STI spread through toys. Washing your hands before and after engaging in hand sex can help lower STI risk as well, and wearing nitrile or latex gloves can help to protect any hand wounds from contact with bodily fluids and can protect partners from sharp nails. Myth 3. If I'm on PrEP, I don't need to use condoms during sex. Pre-exposure prophylaxis, or PrEP, is a medication that can be taken to prevent individuals from contracting HIV. PrEP does not protect from any other STIs. To be best protected from all STIs, individuals on PrEP should still use barrier methods, which include condoms and dental dams during sex. In addition, PrEP does not prevent pregnancy. For individuals with a uterus and ovaries who take PrEP, condoms and/or birth control should still be used to prevent unintended pregnancy. Myth 4. Trans people don't need to get certain preventative health exams, such as cervical exams, breast exams, and testicular exams. As a general rule, if you have a body part, its health needs to be taken care of, regardless of your gender or hormone levels. Unless you've had bottom surgery that removed the testes, it is recommended that AMAB trans adults should have an annual testicular exam performed by a clinician and self-exams performed monthly. For AMAB trans people who have breasts, it is recommended to get a clinical breast exam every 1 to 3 years and to perform monthly self-exams. For AFAB trans people, unless you've had bottom surgery that removed the cervix, it is recommended that you get a cervical exam, also known as a pap smear, every 1 to 3 years. Unless you've had top surgery, it is recommended to get a clinical breast exam every 1 to 3 years and to perform monthly self-exams. While these exams are often uncomfortable or distressing for trans people, they're important for protecting our physical health. Having a trans-affirming healthcare provider that you trust can make these exams much easier. Myth 5. Hormone replacement therapy, or HRT, is an effective form of birth control. While it is true that HRT can affect fertility, HRT does not consistently or effectively reduce reproductive potential in trans individuals, so it is not an effective form of birth control. Regardless of the hormones in your body, if you have a uterus and ovaries, you may be able to get pregnant, and if you have a penis and testes, you may be able to cause pregnancy if you're engaging in penis and vagina, or PIV, sex. Using proven birth control methods is the best way to effectively minimize pregnancy risk when engaging in PIV sex. This includes hormonal contraceptives like the pill or implant, non-hormonal contraceptives like the copper IUD, barrier methods like external and internal condoms, and surgical options such as hysterectomy or vasectomy. It's important to note that besides surgical options, the most effective way to reduce pregnancy risk is to combine a barrier method with a hormonal or non-hormonal contraceptive. We encourage you to talk with your healthcare provider and your partners about what contraceptive options may work best for you. Myth number 6. Birth control will interfere with testosterone in AFAB trans people on HRT. Fortunately, this is not true. There are many birth control options that are known not to affect testosterone levels. Here's a rundown of those options. Progestin-only hormonal contraceptives have been proven not to interfere with testosterone. There are many types of progestin-only contraceptives, including the progestin-only pill, also called the mini pill, the implant, the shot, also called Depo-Provera, and the hormonal IUD. Non-hormonal contraceptive options, which do not affect any hormones in the body, include the copper IUD. Permanent surgical birth control methods include hysterectomy, which is the removal of the uterus and ovaries, and tubal ligation, which is the cutting or blocking of the fallopian tubes. You can talk with your healthcare provider to determine which options may be the best for you. If you would like to learn more about LGBTQ+ health services at Tulane, visit campushealth.tulane.edu/health-center/LGBTQ.